good morning. This is your Julie and welcome back to Julie Vlogs. If you are new to my channel, kindly like, share and subscribe. And friends, I really thank you all for your great support till date. So today we are going to deal with a very important topic, that's about Isbar. So many of us are familiar with Isbar, but many of them are not. We have all heard about nurses' notes, but what is Isbar? It's a communication tool. It's a very effective communication tool. It's very simple for in between the healthcare professionals to understand the patient. So what does this Isbar comes from? How is it framed? This is framed so that whoever comes to the ward, or if there is a scenario, how about the person, about the patient, you can just explain in short. This is about Isbar. So Isbar, what are the things which comes in it? That is I for identifications. So what you will identify? First of all, you have to do the identification of yourself, your patient, and when in my previous videos I have already explained, when you are giving an introduction about your patient, you will emphasize on the patient's details along with the MRN number, and that comes in the identification. That is, you will identify yourself. Who are you? What is the purpose of your calling? And what is your patient's name? And patient's name, I have always said, you will emphasize on the 3 full names of the patient or the complete name of the patient along with the MRN number. So that is coming in the identification. Situation. Situation is what's going on with your patient. What is the reason for your call? What emergency is happening? Why is the reason that you are calling? So that is coming in the situation. Background. So what comes in the background? Background is what is the clinical background, what's happening at that spot of time. So when you are explaining about the background, the person who is listening to you don't know about the patient. Maybe it's an intern, maybe it's a RMO. So the intern may not know about your patient. So when you're giving a background of your patient's detail, so he or she is able to get a complete detailed background of your patient. Next is assessment. Assessment is what assessment have you done? What assessment are you expecting from the person who is coming and seeing your patient? So this comes in assessment. I will explain each and everything in detail, so need not worry, just stay tuned. So one more last and very important point which comes in our Isbar is recommendations. So recommendations is what have you done from your part and what do you expect the person who is assigned to be done. Like for example, if the person needs some time to come from a specific period, like he is attending another patient, he has to come from there till your patient, there is a time duration. So what you are supposed to take is, you can just take a phonic detail that sir or doctor, by the time you will reach here, how can I help the patient? Do you want me to carry out something within the time span you will reach here? So this is about our Isbar. So Isbar is identification, situation, background, assessment and recommendation. So friends, before making a call, we should always know about our patient. So you should have a complete assessment of your patient. You should know whether your patient is hemodynamically stable or not. What are the recent updates about your patients? You should be known about that. And next is read the most important and what are the recent updates which has happened to your patient, whether there is any recent procedures or any lab investigations which was sent, you can emphasize on it. And you should always have a Isbar in your hand, that when you are talking to the other person, if he or she asks you something, you are able to correlate with your Isbar and answer to it. So Now I will just demonstrate a role play that how a Isbar is used. So I am calling Dr. Rizwan. So the scenario is my patient is bad and I have to inform the details of my patient to Dr. Rizwan. So how will I talk to him? So this is what we will say in the Isbar format. So hello doctor, good morning. This is Sister Joy Kuti calling from Ward 6. I am calling to inform about patient Mr. Muhammad Ansari with MRN number 123456. Is this Dr. Rizwan online? So this comes in the identification. Next is situation. Doctor, I am calling because he is complaining of shortness of breath. His vital signs was monitored. He is having a respiratory rate of 36, heart rate of 130 breaths per minute, and his blood pressure is 90/60 mm of Hg. So when it comes to the background, we'll explain what is the background of the patient. The patient's primary diagnosis is sickle cell anemia. He was admitted 3 days ago and he is currently on blood transfusion of 2 units of packed RBCs. Now what is the assessment? Doctor, I have stopped the blood transfusion as I think the patient is having a blood transfusion reaction. So that comes in the assessment. Now what is the recommendation? Doctor, I would like you to come here and assess the patient. Please, is there anything you would like to do before you will reach the place? I have already stopped the blood transfusion. If you want anything from my side to be carried out, kindly give a verbal order. So this is about how we will manage, who can use Isbar. Nurses, physicians, allied health workers, administrators, to and between ward staffs, housekeeping and clerical staff. So the very important, and I'm winding up my video by informing Isbar is a simple structured way to communicate effectively and ensure patient safety.